Thanks for asking me. It's really nice.
It's our pleasure. It's our pleasure. It's always good to hear something new. Now, could you just tell us a little bit about yourself before we launch into talking about the product?
Sure. So I'm Brenda Griffin, and I am a foot health practitioner. I am working part-time in my own clinic called the Mani Pedi Lab. My baby is my other business, which is called Onyfix. And Onyfix is a company that distributes innovative foot care products that hopefully make your lives easier. So we don't want to be another DLT or C&P or Canterbury selling all and sundry to everyone. We specialize in really niche products that are unique to us, and that's where we've come in with the Onyfix. I also work part-time. I'm kind of the on-call girl for 2 podiatry clinics locally to me. They are about half a dozen female podiatrists that work there, and somebody's always got a sick kid or a sick mother or sick somebody or other. So I'm kind of their go-to person for a day here or half a day there. So that's me. And I'm also the newly appointed secretary of the Sussex branch of the Institute of Chiropodists and Podiatrists / College of Foot Health. The first thing I realised when I took over that role was that Sussex apparently goes all the way from Kent to Cornwall. So any of you that are in those areas, you'll sort of come under us as well. So I like to keep busy.
Well, congratulations on the secretaryship, and may God have mercy on your soul, is all I can say.
That's what everybody keeps saying, Martin. I don't know what I've done.
Oh, it's great fun. It's great.
So, I want to share with you some information about the Onyfix system, and at the bottom of your screens there is a chat box, and you can see people saying hello to everybody and Happy New Year, and that's all lovely. What I'm going to do, Martin's going to allow me to share the screen with you in a moment to show you a presentation. So while that's running, if you think of anything that you want to ask, you can either ask everyone. If you have a look in that chat box, you can either at the bottom of it you've got a little drop down box that says everyone, or you can pick a person, so you can have a private message to each other. But if you want to message me and you want to ask a question directly to me, if you select my name, Brenda Griffin, you can ask me a message if you need it to be a private message. Otherwise, just ask to the group, and then when I finish the presentation, I'll dip back into that chat box and I will make sure that we answer all your questions. Okay, so it doesn't matter how mad it is or anything you're worried about, just pop it into that chat box. So without further ado, I'm going to share screen. Is that all right, Martin?
Please carry on.
Fab. Right, so first of all, we go to this presentation. Somebody, Jill, can you just give me a thumbs up that you can see that?
Yeah, I can see that.
Fantastic, marvelous. Okay, so here we are, Onyfix. As you can guess from the first 2 words there, this is a German product. Okay, so this is a product that's been manufactured by a German pharmaceutical company called Neuberg. And Neuberg brought Onyfix into the market, into the international market in 2017. At that time, I was working for another company, and I desperately tried to get hold of Onyfix to bring into them. That didn't happen. I no longer work for them, and I now work for myself. And through links with some people in North America, I managed to persuade the lovely people, Thomas Neuberg at Neuberg Pharmaceutical, that I was indeed a worthy partner to bring Onyfix to the UK and Irish market. And the reason for that is I've been working with light cured nail products for over 20 years. I brought the concept of nail reconstructions to the UK market back in 2000, launching that at the Society of Chiropodists and Podiatrists annual conference in London. And my experience with working with light cured products made me, I think, I hope anyway, a good choice for Neuberg to distribute their product. So I took this on during the very first lockdown, and I did my training originally with a guy that some of you may be familiar with called the Toe Bro, Jonathan Terminus, who's a chiropodist in Toronto. And I've been using it in my clinic, and I have a fair number of people who have now taken this on board and are working with Onyfix in their own practices here in the UK. So they describe Onyfix as a nail correction system, okay, and it is actually registered as a Class 1 medical device. So we're not talking about cosmetic nail reconstructions here. We are talking about correcting basically the growth pattern of the involuted or ingrown toenail to correct it, and you provide pain relief as much as anything else. They are 3 really simple products. We have a soft product, a hard product, and a primer product that we need to use together. They describe it as a pain-free and non-invasive method of correcting ingrown and involuting nails, because actually when you do the procedure, your client doesn't feel any pain or discomfort, and it's a light cured composite material, like a little bit like a dental composite. If any of you have ever worked in those kind of industries as well, it's very similar. And it is actually, I foolishly thought, oh, this is light cured materials, this will be so easy for me, I can do light cured products in my sleep. But actually it's a completely different texture and composition to anything that I've ever used for a toenail reconstruction. So with a reconstruction, I might use a more liquid product like LCN or Vilda, or a hybrid product which is a bit more pasty, but this is completely different. And what we do is we fix a band at the proximal nail fold at the widest point of the nail, and exposing as much of the nail at that point as possible. And we cure it into place with a special LED light. And then as the nail grows physiologically over time, the Onyfix band provides a kind of like a brace, if you like, but unlike a classic brace, say something like a Spang brace, which when you put it on immediately provides tension and pressure, which actually can be quite uncomfortable. When you put the Onyfix into position, your client's not going to feel anything at all. It works over time as the nail grows forward. So if you put a brace on, it's a little bit like when you brace teeth or you tighten braces on teeth, you get a certain amount of discomfort. You don't get anything like that when you use Onyfix. So as the nail's growing forward, it reinforces the natural nail shape and prevents relapse. We can use more than one band as the nail grows over time, and it's freely combinable with any topicals or nail polish, with the exception of a gel polish. You would not use it with a gel polish, okay? And as I say, it's been developed by Neuberg, and they have it now registered as a Class 1 medical device. So that means, you know, we can comfortably fit this in with our treatments in the clinic. So the type of patients that you might want to consider this for as an alternative would be, I'm just going to take a little step back here. This is not necessarily for everyone. Certainly when I go into the clinic and I see on my list for the day somebody it says has an ingrown toenail or pain from an ingrown toenail, you can expect, and you will see everything from somebody who's just got basically a bit of, you know, sock fluff impacted in their sulcus, to somebody presenting you with a sort of bloody, pussy, hypergranulated, you know, almost to the point of you need to chop their toe off and start again. So there's everything in between. But I mean, clearly the extreme cases, you know, if you're not a podiatrist, you're going to need to refer them on. They're going to need to have antibiotics. They almost certainly will need some form of nail surgery. But the classifications, let's say in the lower level, where somebody has got a nail that is constantly pinching them, irritating them, they come to you, you know, on a regular basis, because you are managing that pinching, that impacting. It's not bad enough for surgery, but it's a constant drama for them, and it's constantly what brings them in, and you're constantly, you know, trimming, cutting, filing, and whatever. And really and truly, they probably in the long term would end up having surgery. But for a lot of reasons, one of those being a lot of people may be needle phobic. They don't want to have surgery. It's not for them. They would go to the ends of the earth not to have a needle. You've got your high risk patients for whom having a surgery is not necessarily the best option, including the diabetic patients, simply because of the healing. And when we think about now, when people don't want to come out of their homes, or actually the wound management might be difficult, then for them this might be a good option. We also have to think about what people pay for those treatments, and certainly in the clinic that I sub into, one hallux nail would be $350 plus dressings. I think that's about a ballpark figure. So not everybody has $350, particularly at the moment. There's a lot of people with some financial issues. So to give them an alternative that is cost effective is a good option to have. And then we've got time poor patients as well, where maybe the long-term thing, people have said to them many times, and I actually do have a client like this. She's actually a consultant at A&E. She's on her feet all day, and she said to me, when she first came to me, she came particularly for Onyfix because she was going to see somebody every 4 weeks to have her corners of her nails trimmed, as she described it, because at the end of a 12-hour shift, her feet were absolutely banging. And this was how she had been managing it for years and years and years. And she said, everybody keeps saying to me, I need to have surgery, but I don't have the time. It wasn't that she couldn't afford it. She didn't have the time to take time out of her work schedule, or to even stand on her feet for 12 hours after she'd had surgery. Children that pick their nails, you know, we've all seen them. They do dreadful things to their feet. If they can get their feet in their mouth, they do dreadful things. And then when they start looking after their own hygiene, teenage boys particularly, that's only what I have experience of, because I have 2 boys. Where they start trying to manage their own sort of hygiene and their own nails themselves, and they end up picking their nails. And those nails, they leave little spikes. Those nails struggle to find their way through to clear a good distal edge, so they can actually recover from what they've done to them. And in that instance, you know, using Onyfix to help and guide that nail through is absolutely brilliant. And then you've also got people that have had a traumatic nail loss, say somebody that's lost their nails. I don't know. Normally I would say things like at this time of year skiing, but of course none of us are skiing. Hiking, that's about all we can do. Maybe where they've lost a nail and their nail starts to come through, and for them, of course, those of you that do nail reconstruction know that you could do a reconstruction, but that's not for everybody. Some people are not that bothered necessarily about the cosmetic look of their nail, only that their nail grows through and is guided in correctly to the right position, so that they don't get an ingrown nail, because obviously the nail, when it's coming through, is soft, and their nail bed may have filled with callus and hard skin and so on. So as you can see here, just move that to the bottom. If you can see here, so we apply the band of the proximal nail fold as wide as you possibly can. If they've got what I call, and there's probably a technical name for this, Martin, but what I call chubby toes. So the skin at the side here of the sulcus is quite chubby, and the nail is sitting quite deep. I often will just take the skin away to really expose the side of the nail at this point, because I want to make sure I get right to each side here and bevel each edge. And then as the weeks go on, you can see that it's starting to pull the nail out of that curved position into a more straighter position. At about 20 weeks, you could, at this point, particularly if the nail's very curved, had started very curved, you could add another band in behind it just to kind of reinforce that as it goes forward. These bands will stay in place right until they grow off. Okay, so you don't have to worry about each time they come, you need to replace them or anything like that. The bands themselves are only 2 millimeters in depth and 2 millimeters above the nail, so that they don't impose massively on their sort of socks or anything like that. And by 30 weeks, you're going to see really good results here. And I have to say, patient compliance is very, very good, because you really do get them out of trouble. So the starter kits that come with the training contain everything that you need. So you've got the soft, the hard, the primer, a few little accessories here, and most importantly, this LED blue light. One of the questions that people often ask me is, I already do nail reconstructions and I have an LED light, can I use that? And I have to say, I had the very same thought myself, because this one you have to hold, and usually when we're doing nail reconstructions, we can put the light down over the client's foot and carry on doing something else. But this actually is a much more powerful light than we would use for nail reconstructions. This is a much more powerful, and because this resin is a completely different kind of composition. So we apply a tiny little amount here. Out of these tubes, you're going to get, from the 2 tubes that you have in the starter kit, you will get between 75 and 80 applications. So it's quite cost effective. It's going to cost you around about £4 to do this procedure for your client. So it's like a paste. We put it on with a probe here, and we sort of pat it and guide it into place, and then we cure it. So the primer is acting as a bonding agent, and it is light cured. We use a tiniest, weeniest little amount of this, and we put it on with a cotton bud. And actually, one drop of this we can use on about 4 nails if you were doing that many nails. So it's very, very cost effective, and that is cured with the LED blue light. We have, as I said, 2 types of Onyfix. The Onyfix soft we use for small nails, for thin nails, and soft children's nails. And we use a special applicator that we put onto the end of the syringe. This comes in a syringe. It is a very fine applicator, and it's quite a different consistency from the Onyfix hard. This one, again, we cure in the blue LED lamp. The youngest person I've used this on is a little 7-year-old on her on her 5th toenail. She's a little dancer, and her nails were very, very curved and giving her a lot of pain, and we've managed to straighten her out, and she's absolutely delighted, and her nails are nice and flat now. I hope that they will stay like that, but her mother knows that she can come back and have another application if she needs to. The hard is what we use the majority of the time, really, for big nails, strong nails, thick nails. Certainly with a hallux or a second nail, I would probably almost definitely use the Onyfix hard. And as I say, we don't want to use too much, but we don't want to use too little. And we also want to make sure that we shape it correctly so that it is a nice equal band. If we have any kind of like wobbles in it, any kind of thin bits, then those are going to be stress points, and they're likely to snap as the nail grows forward, because it is going to pick up tension as the nail grows. So this is how it's applied. You can see it just sits here as a little band at the, as close to the side of the nail as possible without actually touching the skin on both sides, and as far back into the proximal nail without touching any sort of cuticle or the nail fold itself. And we also have the option of doing what we call a half band, and this is actually really quite fabulous. Often when you see somebody, they come in with that pinching in sort of, let's say, the lateral corner or whatever, like on this nail here. What we can do with this corner here is, of course, we're going to clear out the sulcus and any debris as we ordinarily would do, and any spikes or anything like that have been left behind with sort of poor nail cutting. But at that point, we can actually pack this corner just with a little bit of lint-free swab or something like that. Just pack that corner or elevate it with the spatula itself, which is a little bit more tricky. You sort of sometimes feel like you need 3 hands, so I find it easier to pack it, which can just give a little bit of pressure. And then when I put the half band on and I cure it into place, pull the packing out, that nail will actually stay elevated from the corner. So you can give people absolutely instant relief, which they just find amazing. And unlike something that you would use for, let's say, a nail reconstruction, which is flexible. The whole point of nail reconstruction products, the light cured products, no matter what brand you use, is that they are flexible. This is not flexible. This will cure rock hard. So when we've elevated that corner, we've got the band in place, and we cure it, take the packing out, that will stay in place and gives absolute instant relief. So they have done clinical trials, and when we do the training, we go through a little bit more detail, but just to kind of give you a little overview, they did over 100 subjects, mixed age range from 17 to 96 years, and across two centres in Germany and Denmark. And just, you know, looking down that, you think, well, hang on a minute, when they got to 42 weeks, only 11 people were really happy. But then actually, when you think about your patients, if people come to you because they're in pain and you get them out of pain, then they don't come back, right? Because they're happy. And that is kind of what they found. Of course, this fits in nicely with your routine treatments. If you're seeing people every sort of 6 or 8 weeks, then you're going to be observing this as it grows. It doesn't stop you booking them in for routine treatments if that's what they need to have. Or if they're only coming to you for this one nail, then you would definitely see them about every 8 weeks, just to kind of keep your eye on it, monitor things, make sure everything is as it should be. And then possibly at some point, maybe at 16 weeks or maybe at sort of 24 weeks, you might put another band on at the back, depending on the rate of growth and so on. But it doesn't preclude them having routine treatment with you either. So these are just some of the pictures that we have where they've used a measuring tape to see, and I do tend to take pictures of everybody. Like most of you, I suspect I've got quite a good toe porn collection on my phone, and I tend to put everybody into their own little file on my phone so that we can always monitor and see where they've gone. So you can see this one, after 33 weeks, that nail is quite nicely straightened out from a nail that is quite obviously pinching in each corner. This one here as well, this is with the Onyfix hard, and you can see that after just 36 weeks that nail is given good relief. This one too, this is Onyfix hard, and after only 18 weeks that nail is not pinching. These are the kind of classic things that you would be constantly you know, they never get a good distal edge on their nails. They're constantly filing them down, they're chipping away at the corners, anything to give that relief where that is involuting or pinching. So even if the nail is almost strangling the nail bed, you know, what you might call it a snail nail, you can straighten that out using the Onyfix system. This is the Onyfix soft on a smaller toe, and you can see after just 18 weeks that has straightened out and that curve has disappeared. These are just some of the more dramatic pictures. The one on the right here, this is the sort of classic thing where you see that sort of nail really sort of twisting right under. And that after 36 weeks they've managed to straighten that out. And the one on the left, where you know the nail is literally strangling that nail bed. And I suspect on this one that there's probably been looks like some surgical procedures been done in the past with that one, doesn't it? Because there's a little bit of a scar there. Yeah. So just to sort of conclude it, it's a new treatment, new to the UK. We launched this back in November, and you know, it's really effective. And the feedback that I've had from people that have done training with us already are that their customers are really happy with it. They're happy to be given an alternative that's not necessarily surgical. And it may well be that it's a conservative treatment that you start with, and it may well be that in the end they have to have surgery, but somehow people like to have something a little bit more conservative to start with. But the majority get out of trouble using the Onyfix and don't have to go down that surgical route. They like the fact that it's pain-free, and it's, you know, rather than a nail brace, which is either, you know, 12 mil, 14 mil, 16 mil, and you're cutting bits off and filing it round and sort of trying to fit it. And also fitting it is a faff, you know, gloves here and glue there and all the rest of it. It just goes on honestly like a dream, and it takes me probably about 5 minutes. So when somebody comes in for a routine treatment, I can slot this into that routine treatment time without having to say, oh yeah, well, we could do this for you, but I'm going to have to get you back, and then there's no room in the diary, and blah blah blah. I can slot that into that half an hour appointment very, very easily. You know, I will be saying to them, we could do this for you. I have a little short video. The one I'm going to show you in a second is slightly longer, but there is also a short video which is about 1 minute and something, which is a real kind of like end consumer video to explain to the customer how it works. And I actually keep that on my phone, and when I'm talking to them and while I'm doing everything else, and I'll say to them, you know, we could do this for you, and I show them the video on the phone, then they immediately understand what it is you're trying to achieve. When I did some training in a podiatry clinic a couple of months ago, the model guy that they had come in to try this out had previously had he had had nail fenestration with the clear nail system. He had had the packed treatment on top, but his nails were still, because they were sort of thinner, obviously after having had all of that treatment, his nails were starting to curve in. So we concluded the whole thing with Onyfix, and he was a very well-researched gentleman, and he said, I have been looking at this online, and I've watched the Tobro videos. So, you know, all of that kind of stuff will help you with your marketing, because you know, people know who these guys are now. People are very well informed, and they search for things on the internet before they look. And the fact is, you can show them this quick video and they get it, and immediately they say, yeah, that's absolutely fine, go ahead. So in terms of sort of economy, we charge, and we would recommend a charge of £40. That's £40 for one, what I call a big band on a large nail with a hard, and we charge £20 for a half band. We would usually do a band and a half, never just a half on its own. And for children, I charge £25 per nail. So that turns that, you know, £35 appointment into a £75 appointment. And you have to explain to them the next time they come, they're just going to be on a routine price unless something amazing happens and they need to have it redone. But if they had to have another band put on, you know, after 18 weeks or so, then there would be another charge. But honestly, nobody has said, actually, no, you're all right, just leave it. I can't afford it, or I don't want it, or I don't see the value in it. Everybody's been more than happy and then delighted with the outcome. Just to let you know, we are only marketing the Onyfix to podiatrists, chiropodists, and foot health practitioners with training here in the UK. This won't be sold into the beauty market. In North America, they have a slightly different strategy, and they also have a different class of a pedicurist there. They have something called a medical nail technician, which we don't have here. A medical nail technician is somewhere between a kind of advanced pedicure and an FHP, and they do sell it there into that market. That's their decision. That's North America. We don't have that classification here. So we have made the decision. I run this business with a business partner, and we've made the decision that we will only sell this to podiatrists, chiropodists, and foot health practitioners. And as directed by Neuberg, it is only sold with training. So nobody can put it in their basket on my website unless we know who they are. And if they do, we obviously would challenge them. So you don't have to worry that people are just buying it willy-nilly. The training is done online because this is the only way we can communicate with people at the moment. But it actually works really well. The class is about 3 hours long, and we keep the classes quite small because I quite like to see everybody and be the closest thing to being in the room with you without being in the room with you. It includes your starter kits, so the Onyfix, which is the 3 products, the soft, the hard, and the primer, and then the Onylux is the light unit. So those are together in one package, if you like. You get training materials, and there's a knowledge test afterwards, and then you have to complete your case studies. So there are 5 case studies that you have to send through to me. I'll explain all that to you. It doesn't necessarily require you to do 5 people. You might do 2 or 3 things on one person. Obviously, you get the backup and support of me up until 10 o'clock at night when my phone goes to sleep. And that includes all your sort of marketing materials as well. There are client leaflets, there are posters. You can have those sent to you, and you can overprint them with your clinic details and so on. So they're all there. So that is the Onyfix system. Now, what I'm going to do is exit that one and show you this very quick video. And then we can have your questions. So
we would like to introduce the new Onyfix pain-free nail correction system. With 3 products, primer, soft and hard, Onyfix offers a completely new way for you to treat your patient's involuted toenails painlessly. To help you get the best out of the Onyfix nail correction system, you will find additional materials in the Onylux toolkit. We would now like to show you in 6 steps how to use the Onyfix nail correction system. Use a burr to roughen the surface of the nail you wish to correct. This enables the Onyfix primer to create a good grip. Now degrease the nail. This step is also necessary to ensure that the composite adheres correctly. Put 1 drop of Onyfix primer in the lid of the primer bottle. Use a cotton bud to spread the primer thinly and evenly on the entire nail. Hold the LED blue light lamp close to the nail and turn on for about 10 to 20 seconds to dry the primer. The primer needs to be completely dry. Using a spatula, take about 1 millimeter of composite from the Onyfix hard syringe and put it on the nail. Shape the composite on the nail into a strip about 2 millimeters wide, running as far as possible from the lateral to the medial nail edge. The nail correction system should be positioned in as proximal a position as possible. The composite must be shaped on the nail without applying pressure and flattened out to the nail folds. Ensure that the composite does not touch the skin. Working it with a spatula softens the composite, which will not harden until cured using the LED blue light. To harden the nail correction system, again hold the LED blue light close to the nail and turn on for 20 to 30 seconds. The dispersion layer can be removed using the cleaner. Once the Onyfix composite is fully cured, check that the nail correction system is even and not too thick. Onyfix should not be applied to a thickness greater than 2 millimeters. If required, the composite can be gently abraded and corrected using a burr. It is also possible to apply a second distal nail correction system in addition to the proximal nail correction system, if necessary, in order to speed up the results. As a result of nail growth, the old nail correction system has now migrated to the distal edge of the nail. If the nail is still not correctly shaped, a new nail correction system should be applied to the proximal edge of the nail. Remove the old nail correction system using a carbide burr. Alternatively, the old nail correction system can also be removed using nippers. The nail is now once again prepared and treated as you have seen in steps 1 to 6. If the nail is only involuted on one side, you should apply the nail correction system to just half of the nail, which should be prepared as described above. Once you have shaped the nail correction system on the nail, lift the affected side using a spatula. Keeping the nail lifted, use the LED blue light lamp to harden the composite whilst retaining the required shape. For small and soft nails, use Onyfix Soft. When using Onyfix Soft, you should once again roughen and degrease the nail and apply the primer. Attach the enclosed cannula to the Onyfix Soft syringe and use this to apply the composite. Using a spatula, again shape the composite to the required shape. The soft composite is likewise cured using the LED blue light. Hold the light over the nail for at least 20 to 30 seconds. Painless nail correction with Onyfix is as simple as that. Contact us for further information.
So that is the Onyfix system. It's been lovely to be able to share these things with people on Zoom, because I think one of the things that we've all been missing this last year is attending all the conferences where you go to see everything that's new and have a little play and have a little try and see what it's all about. So, you know, thank you for letting me come into your kitchens and your office spaces to see the Onyfix system. Now let's see if we've got any questions from any of you. No questions. Amazing. Martin, have you got any questions for me? I can't hear you.
Right, can you hear me now?
I can hear you.
It's okay. I muted myself during the course of your video so that you wouldn't get howl around from my.
That's all right.
But of course, the thing is with this system, once you mute yourself, you cannot unmute yourself. So that's why I was doing all these strange I was waving to Jill and Kirsten. So dancing. Brenda, that was absolutely fascinating. I think you made some very interesting points that many of us could pick up on and sympathize with as well. I mean, I think first of all, we sometimes underestimate how terrifying nail surgery is to some people. I mean, you mentioned their needle phobia. Yeah. I mean, so they just go to bits. They just go to bits. If you explain the operation to them and you say, right, I'm going to inject a total local anesthetic and then do this and do that, and you can actually see them turning pale.
Yeah.
You know, almost going a little bit woozy. I mean, I've had a few people, well, more than a few people, who absolutely desperately need nail surgery. Considered a general anesthetic for some of them, which obviously can be done at the hospital, although that's over. It has to be done in a full theatre, to which most people don't have access.
Yeah.
Or failing, sometimes I have to give them some kind of preoperative sedation of some kind, or prescribe them some Valium, or prescribe them some temazepam while they're actually having the procedure, so that they sit there with a smile on their face while I actually stick needles in there.
I mean, it's a big thing, isn't it?
It is a big thing, and some people are plainly terrified. And of course, nail surgery isn't always the whole answer anyway, because as I'm sure most of us know, there are different types of nail surgery. You've got partial nail avulsions and femalizations, you've got Winograd's procedures, you've got Zardik's procedures. The last two are complex procedures where you're actually doing an incisional procedure and then suturing afterwards. And sometimes, depending on a podiatrist's level of training, the only procedure they will be doing is a partial nail avulsion and femalization. Now, there are some people with some medical conditions, especially with delayed healing conditions, that it's not always appropriate to be pouring some acid down the side of the operative side that you've created. So some to do an incisional procedure, But of course, then that's the next level of training. And once again, there's a substantial number of podiatrists who can't do that. So I think
and notwithstanding the fact that, of course, as a foot health practitioners, they will never be able to do that. You know, so it's nice if at that level there's something to offer before you know, if it comes to the point where you have to refer it on, of course you must refer it on. But as you say, not everybody that even doing chiropody or podiatry are doing nail surgeries.
Indeed.
So
I've got a questions. Could I just put a couple of brief questions before we answer the questions coming in?
please do.
First of all, the actual substance itself, when it sets, does it set to be a non-absorbable substance? I'm thinking of somebody who then goes along and applies nail polish to it.
No, it's absolutely fine. It's a non-porous product, so you can actually apply nail polish to it. I had a couple of ladies throughout the summer who applied nail polish just to kind of disguise it. I have to say, not my prettiest work in terms of nail polish application, but you know, the visual was there. Nobody knew they had the Onyfix on. I was told not to use gel polish, but you know, just because you tell me to do something or not to do something, it doesn't mean to say I always will listen to you, because sometimes I get, you know, carried away. And I did put gel polish on one lady, and it was an absolute bee to get off, and I had to end up taking the whole Onyfix off and start again. So definitely don't use gel polish, only use regular polish that they can, you know, take off themselves.
Okay. The other thing, just briefly, is you obviously got a lot of experience of using this. Now, as we all know, listening to this, nails are a trilaminate structure. You've got essentially the three layers of the nail: the ventral layer, the intermediate layer, the dorsal layer. Have you ever seen a situation where the actual layers of the nail have separated as it grows forward, where they've delaminated essentially?
I know what you mean. I haven't seen that, and I trained with Jonathan, and I also trained with a guy called Tom, and you know, they have a lot of anecdotal evidence to sort of add to what they have done, and that hasn't occurred. I mean, I can certainly ask the question, but I haven't had any reports of that happening.
Well, no, I mean, I would imagine with that degree of experience, you know, it's not going to happen, especially, I suppose, with a slow growth rate.
That's right.
It'd be a gentle thing. Excellent. Yeah. We'd better go over to the chat box now, because I can see quite a few questions coming through. Over to you.
Right. So, yeah, well, I guess Happy New Year, everybody, especially my friend Myra, who's there. Thank you very much. Always lovely to chat with you. Cost. Okay, so we talked about that at the end. So the course is $4.99 plus VAT, and that includes all your certification. It includes lots of communication with me marking your work, sending it back to you, and so on. And then you get your certificate once you've done 5 case studies. Out of that $4.99 investment from you, when you can do between 75 and 80 cases out of it, calculated on the earnings that I've said of a minimum of £40 for a large band and £20 for a half band, 25 for children, roughly speaking, deducting your £4.99 investment, you're going to earn about £2,500 out of that kit. And that is important for you to understand, that, you know, you're going to get a good return on your investment. It costs probably, I say probably, we estimate it's going to cost about £4, that's £4 to actually put a band on, okay? And then you're charging your patient £40 on top of your routine treatment cost. So that, I think, answers that question. The other thing is, if you're paying for the training, which you can book online on the Only Foot Care website, if you go there, click into Onyfix, and you'll see all the training dates. I've published the dates right up until April, I think. If none of those dates suit you, just send me an email, info@onlyfootcare.com, and I'll, you know, put something together for you. That's not a problem, because you know, life's reasonably quiet for most people at this moment in time. The shelf life is, you're going to get about 3 years out of light cured materials. If you haven't done that many nails in 3 years, you're probably in the wrong job. And the other thing I was going to say about the paying for it is, if you pay through PayPal, there is a system called PayPal Credit, which allows you to pay for purchases like this over 4 months. So you can actually sort of access your own credit stream there, which I know a number of people have done in the past. Long in the tooth beauty therapist, welcome to the club. I think, you know, when you come from that beauty background, you can definitely see the potential in this. But as I said, we won't be selling this into the beauty business. This will only come into for health practitioners, chiropodists, and podiatrists. So the product cost after the starter pack, so the individual products are £63 plus VAT. So generally speaking, the second order that you place is for a tube of hard, because that's the one that you use mostly. And then the next thing you'd order is your primer, and your soft is probably the one that you order least. And when you place an order, you'll get a load of client leaflets as well, will come through the post to you. But some people like to have the PDF so that they can put their own client, their own phone number on it, or their own stamp or whatever. And things like the graphics, the pictures that you've seen in the presentation, you also get copies of those, so you can start your own online marketing, you know, your social media stuff, and get going with that. If a client asked what the success rate was before they wanted to commit, what would you be advised to tell them? Well, the figures showed you 96%. So, you know, figures, they're so difficult, you know, how many percentage is this, how many percentage is that? When you explain to them what you're going to do, they can see immediately what the prospect is going to be. It's going to be slow in terms of, you know, it gets put the proximal nail and it grows, the nail's growing forward. So it's correcting that nail over time. As I say, with the little video, the short video that shows the nails on track going from this, sort of this to this, they immediately see what it is you're trying to achieve for them. And they literally don't have, I've never had anybody say, no, I don't want it. Nail polish remover is not going to affect it. No, not at all. Not even acetone. What is your return treatment against your normal treatment? I don't understand what you mean, Caroline. What is your return per treatment against your normal? I don't understand the question, Caroline.
I think you covered that with the cost of £40 per application.
Okay.
And that would be in addition to the normal fee that you would charge for a normal appointment.
Yeah, I mean, it's definitely an on top price. I always say to people, it's like this. If you go to the dentist for a checkup, you go and have your checkup. I'm going on Monday, and I think it's like 35 quid or something, isn't it, to have a checkup? But if he tells me that I need to have my teeth cleaned or I need to have a filling, there is an extra cost. So, you know, you must never be embarrassed about saying, I can do this for you, and this is how much it costs, because everything has a cost, right? You can't do everything for 20 quid. It's just not possible. Nobody would be in business. Himsun Key says, how long can the non-involuted nail last after the use of Onyfix? Well, the Onyfix will stay on until it grows right to the end. If you just do one side of the half band, you put the band distally rather than proximally. Can you put it proximally? Half band you would always put right across, the whole band you always put at the proximal point of the nail. The half band is just to relieve any pinch at the front. Personally, that is like a PR video, but when you go into more depth with training, I definitely would always put a proximal band on and a distal band on. And then we have another thing called a T-band, which we'll come to when you do the training. So there are lots of different ways that you can relieve the discomfort in the first instance when you put the band on.
Right.
That's all right, Caroline. I think we got there in the end.
The last question that you answered.
Yes. Oh, sorry. This from Himsun Shi. If you stop using it, will it become involuted again?
Yeah,
There is always a risk. And if the nail is very, very involuted, you would definitely put more than one band. You would be training that nail over quite a long period of time. You may even do as many as 4 bands, okay, to correct the nail. And it may be, if the nail starts to go again, that they always wear a band. But that would be preferable to that nail involuting, causing them discomfort. Does that answer the question? Yeah.
Seems reasonable to me. I mean, I would imagine as well, the more proximal that you put that band, the more pressure you're actually going to look at put on the nail matrix itself. And the nail matrix is quite a simple construction under the epimysium. So perhaps you're retraining that tissue to no longer be involute, because the matrix must be involute if the nail's going involute.
And does this system work for ingrown nails as well as involuted and pincer nails? Yes, it does. It does. There are always going to be times when a partial nail avulsion or a complete nail removal is going to be the answer. So this is not like an absolute alternative. Of course, surgery always has a place. And sometimes, you know yourself, when the nail tissue decides to go rogue and it just spills out the side and it's going this way, that you have to have nail surgery. There's no way that you can bring that back in. But you know, for I would say a very high percentage of when people come into the clinic and say, I've got an ingrown toenail, they haven't got an ingrown toenail. They've got a nail that's pinching, that's curling in. And obviously, I mean, you still have to have those conversations about footwear, about, you know, space in the toe box, and all of those other questions and all those other things that you would ordinarily talk to your patients about. But you know, giving the toe its space. But you know, for some people, this is quite a something that, you know, maybe they've even inherited it. If you want to look at some gory videos, those of you that follow him, if you don't follow him on YouTube, I suggest you find him, and that is the Toe Bro. Have you all followed him? You know, those of you that love Dr. Pimple Popper. But this guy is called the Toe Bro, B-R-O, and his name is Jonathan Tomines, and he is a chiropodist, they call them in Canada, in Toronto. And if you search for him on YouTube, he has a number of videos that he's put up with sort of, you know, real live patients, what he's done with Onyfix. So you can have a look at him as well, just to sort of see how he applies it. So yes, I think, where are we? 25 past. We're pretty much bang on time, Martin.
That's very good timing, Brenda. Absolutely marvellous.
You're welcome.
There's a little question there from Leanne
yes.
saying, what if the patient has an infection? Would this be only used on clean and non-infected nails?
Yes. Now, if somebody presents you with an infection, I definitely would get that infection cleared up first. The sort of no-nos are blood and pus, basically. You know, you absolutely have to have a dry nail, and you also want to make sure there's no infection and no oozing before you apply it. Absolutely, definitely. Yeah. As I say, we reinforce all that information in the training. There's a nice training manual, and you know, there's lots of opportunities to chat and even go off topic as well when you do the training. So I hope to see some of you soon. The next training dates, just to run through them really, really quickly, we've got Saturday the 23rd of January, we've got Monday the 1st of February, we've got Thursday the 18th, Monday the 1st of March, that looks like Sunday the 7th of March. As I say, if there's a group of you that want something special, like if you want to do it as part of your branches, you know, we can do something special for branches, do a little thing for you. Some of you might not have attended here. One day we might all meet again in a room and actually be able to touch each other and hug each other, and that will be lovely. And you know, we'll meet again some sunny day. But I don't honestly see us going to trade shows or doing anything in that vein until probably September at the very earliest. Martin, do you?
I don't. I mean, we're already making plans, as many people will know. You will know as a brand secretary for our AGM to be a virtual event again this year.
Yeah.
And there's a lot of places all over the world doing that, because Canadian lot that I gave some talks to last year, they had a virtual event in September that replaced their normal AGM in May.
Yeah.
So I think virtual one again this year, and we certainly will be doing one as an organisation.
Yeah.
You've actually got there in the chat, I see from Kirsty, your website. And is it your website, www.onlyfootcare.com, that they book via?
Yes, yes. If you go to onlyfootcare.com, that's the website, and you'll see on the home page, you'll see Onyfix. You just hit that button, you go straight in. It tells you all about it, and a little bit of teaching, and all the sort of booking is there. So if you can't find a date that suits you, but you are interested in training, you know, just ping me over an email. I'm more than happy to accommodate anybody. You know, I'm happy. It doesn't matter whether it's morning, afternoon, or evening. You know, it doesn't matter. We have little Zoom formation things that go on that I advertise on the Facebook page. So Only Foot Care has its own Facebook page. If you follow me on there, there's other things coming up. One of the things is about the new range of foot foams, which is coming from Neuberg, which is quite interesting. That's coming up soon as well. Again, those evidence-based foot foams for various skin conditions. So yeah, this is just the way of the world, right? This is, we all have to just sit there and look at screens and get our information, because, you know, with the best will in the world, it's just, I'm not even going to say strange times because I hate that expression, but you know what I'm saying.
Yeah, I had a look at your website just before we came on air, and it looks as though you're carving yourself a nice little niche out there for niche products that you wouldn't really.
That's the target.
Looks very, very good indeed.
Thank you. Thank you.
Well,
thank you.
We've come exactly to 8:30, so the timing was absolutely flawless. Well, a huge thanks to you, Brenda, for giving us a fascinating insight into this, and also a huge thanks to all the people who come to attend tonight.
Yes, lots of people. It's been nice to see a few faces, because I see your names on Facebook, but now I know what you look like.
Excellent. Thank you very much indeed.
All right, you're very welcome.
It's put there. We've got a webinar next week as well, so they're really working hard, this lot. But that's on podiatry witnesses. So if you're interested in medico-legal parts of podiatry and its witness work, then please, all of you, come and listen. It's quite interesting. I'll be talking to Hayden Kelly, who's admittedly one of the best medico-legal experts in the UK now. He's just published a very good book on it. And I'll also be talking to Mark from Bond Solon, who are once again the main trainers for expert witness training in the UK. So it promises to be very good. And of course, medico-legal work is appropriate to everyone, whether you're going to be an expert witness in podiatry or not, or whether you're just perhaps at some stage going to be involved in a medico-legal case purely as a witness, which can happen. So this is a way of preparing yourself for that. So I'll look forward to seeing as many people as possible. And perhaps, Brenda, if you'd like to come, we'd be very, very welcome. Come and have a look. Okay, well, thank you. And good night to everybody, and thanks for coming.